If you move your lower back in the same two directions that chiropractors use to release lumbar joints, you can often release your own back, both safely and comfortably. So here's how. To release someone's lower back, chiropractors commonly use a combination of rotation and flexion. Both of these motions open up the joints in the lower back, releasing any restricted joints. You can do something very similar at home on your bed. Lying on your side near the edge of your bed, turn your face up and place both hands on the top side of your chest with your top elbow back. Both your chest and head should be facing up. Start with your bottom leg straight. Then flex the top leg about 90 degrees, straighten the leg out and return. And do that 3 times. Each time you straighten the top leg out, relax and let the weight of it hang a little. Then flex your bottom leg to about 45 degrees and do it another 3 times. You might notice that your top knee comes up a bit further now. This opens up different joints in your lower back. Next, with your bottom leg straight again, do 3 big circles with your top leg, keeping the top leg fairly straight. And finally, bend your bottom leg to about 45 degrees again and finish up with another 3 circles. Keep the movement smooth and slow. Don't do any sudden jerky movements to try to crack it, as this can aggravate things. Just let gravity do the work. In fact, you can let your leg hang for several seconds at the end if it feels good. This technique tends to be most helpful with the painful side of your back up. If your back hurts on both sides or in the middle, you can do it on both sides, but don't do any movements that hurt. If it hurts, it means your back is too inflamed for this exercise. The first day you try this, just do 1 set and see how you go. If it feels good, you can do this a couple of times a day, but I wouldn't do it any more than that. If you want to try a slightly different way of opening up the lower back joints, try this seated exercise. Cross your leg, use your forearm to lift your knee towards your opposite shoulder, rotate a little bit more, and then lean away from the side of the lifted leg for a second or 2. The side bend motion is another way of opening up spinal joints, so this can work well for some people. It tends to be more helpful leaning away from the side of pain. Repeat it 3 times, gently, once or twice a day. You can do this exercise on both sides too, but only if it's pain-free to do. If you find it difficult to pull your knee in with your forearm, you can just use your hand instead. Anyway, I hope that helps. If you want to do more for your lower back, I'll leave a link in the description box below to another video that might help you out. Okay, cheers.